There are more concerns about the health implications long-term of the coronavirus vaccine. One prominent virologist is questioning whether the newest boosters are really better than the original. And there are more questions. Correspondent Jonathan Seri has the story tonight from Atlanta.
The Biden administration continues to urge Americans to get updated COVID boosters targeting both the original strain and the Omicron subvariants BA4 and 5. But a former member of the CDC's Independent Committee of Vaccine Advisors points to two studies suggesting the new shots offer no significant advantage over the original boosters. In an opinion published in the New England Journal of Medicine, Dr. Paul Offit suggests booster dosing is best reserved for the elderly and people with underlying conditions, but adds, "I believe we should stop trying to prevent all symptomatic infections in healthy young people by boosting them with vaccines containing mRNA from strains that might disappear a few months later." The White House points to other recent data suggesting the new shots offer better protection against hospitalization and death.
There are now at least 5 high-quality studies that demonstrate that. They're all done by independent labs. So there's no question that the current vaccine that is available is better than the old vaccine.
Some independent vaccine advisors to the CDC and FDA say they're disappointed government and corporate scientists did not draw their attention to preliminary data last year suggesting Moderna's updated booster did not offer much more protection than the original. One of those advisors says he does not think the information would have changed their recommendation for the booster, but it would have been useful for discussion.
Even though the data were preliminary and incomplete and the study was not designed to be an effectiveness study, nonetheless, I think those data would better have been presented.
The government continues to fund free boosters for Americans, but demand remains low. Less than 18% of U.S. adults have received one. Bret?
Jonathan Seri in Atlanta. Jonathan, thank you. Here to talk about those issues and others tonight, Dr. Marty Makary, Johns Hopkins health policy expert, Fox News contributor. Doc, thanks for being here.
Good to be here.
You know, there are increasing reports, you see them online, and you wonder where the truth is, that there's signaled data, is what they say, that there are increasing concerns about the vaccine. First, explain that, these reports and where they're coming from.
Well, we have a lot of reports now that are finally getting at the risk of heart attack and other severe adverse events after the vaccine. A study published by Freeman in September found that it was 1 in 800 doses. It was consistent with a previous German study. And we had the Florida study by the Surgeon General there that looked at the risk of heart attack after the vaccine, went up 84% in the month after the vaccine. So there's something going on. And of course, we got the big study published 2 days ago in 17 million Medicare beneficiaries, and it found that a 40% increase in myocardial infarction was observed and a 50% increase in pulmonary embolism, or a blood clot to the lung.
Now, the FDA put out a statement in the Associated Press saying that it has not found any causal relationships between Pfizer-BioNTech COVID-19 vaccine and the potential adverse events of special interest identified in 2021. The FDA continues to find that the Pfizer-BioNTech COVID-19 vaccine meets the FDA's rigorous standards for safety and effectiveness. That's their statement.
Look, public health officials, from Dr. Fauci to the leaders of the CDC and FDA on down, have really made this a dichotomous issue. You're either on board or you're not on board with an indiscriminate vaccinate all of the population message. And the reality is it's more nuanced, that the risk-benefit ratio changes when you get down to a young, healthy person. And there's nuances. The Moderna vaccine has a higher risk of myocarditis, which is why it's been restricted in parts of Europe, and countries in Europe like Denmark and Sweden recommend against the COVID vaccine in young people.
And we're hearing more advisors to the FDA and some of these board members speaking out publicly saying they wish they had more of the data that's out there now as they were making the initial discussions.
That's right. This study of 17 million Medicare beneficiaries, why are we getting it now, 2 days ago, 2 years after the vaccine's been distributed at large? Why not do that interim analysis with 5 million Medicare beneficiaries or 1 million? I think there's a frustration that when somebody has a heart attack right after the vaccine, you can't make any statement about that causal relationship. But you've got to do the studies of the patterns. In the U.S., there's been no interest in looking at vaccine-associated complications. Most of our learnings are from overseas.
And we're getting, some of this indication of the administration and others working with social media to censor different people. Dr. Offit was one of them.
That's been the greatest frustration for all of us that do research. We use Google in research, and doctors use it when they look for studies. And Google has downplayed many of the studies that we need to look at about natural immunity, about vaccine complications, about the ideal dosing interval. That may be one of the causes of these complications. No vaccines given 3 and 4 weeks apart. They did it that way to get the trials done quickly. The ideal spacing is further out. So it's frustrating when you're trying to do research and the research tools that you have are giving you the standard CDC and FDA party line.
Last thing, do you think we as a government, we as the U.S., have learned from this experience and we're going to put more money into our own testing, not relying on foreign governments' testing, do things that change the way that we deal with the next health policy emergency?
I think people are now learning about the actual data, and they're realizing it's not as simple as the vaccines were sold. The whole COVID pandemic really spared young, healthy people, and we didn't have good numbers around that. That changes a lot when we talk about COVID policy in schools. So I think now there's a healthy skepticism that we should ask the questions we normally ask as researchers and journalists, and not just inherit a bandwagon thinking like we did with, say, hospital visitation of patients or school closures. Now we're going to ask questions.
Dr. Makary, we always appreciate you coming in.
Thanks, Bret.
Thank you.